It's 4 o'clock on a Sunday afternoon.
Looks like we've got single vehicle RTC.
The car that was being driven at high speed has veered off the road and hit a wall.
Okay, it's not LPG, fellas.
We are the first on scene, so the first thing we obviously need to do is make sure that our safety and all the other motorists' safety is looked after. So we'll approach slowly and we'll fend off and make a safe area, and then get off the safe side and make ourselves as visible as possible to other members of the public so there's not another accident. And then we'll approach the vehicle and we'll be looking to centre on the casualty to look at what types of injuries are likely. We talk about the kinematics of injury, so look at how the car is damaged will give you an indication of what injuries are likely.
The fire service's first aider looks after the casualty until the ambulance crew arrives.
Right, chap, who's in charge, please?
Yeah, single vehicle RTC,
Yes.
front impact. Looks like there's a bullseye there.
Okay, thank you.
We've got our medic in there at the moment. He's just making a full assessment. We haven't made any plans as yet, because I'm waiting for information from him.
Okay, thank you. Right, which medic is in charge in the passenger seat?
Yeah, he's in the
Okay,
passenger.
thank you.
His name's Mark.
Righto. Right, student, can I have you back into the back of the car there, please, for me? Don't take over until I ask you to in terms of neck control. Fire brigade medic, right, hand over, please, to the patient.
We have a 35-year-old male called Jim, no physical entrapment, appears to have hit his head on the windscreen. I'm definitely suspecting neck and back injuries. I don't believe there's any leg trauma at all. In my opinion, I'm not sure time critical yet.
Okay,
so if you
fine.
can make a full assessment.
Right, thank you very much. Is this door open?
No, that door's locked.
Right, okay, thank you. Right, maintain with C-spine, please, first of all. Okay, right, okay. Right, I've got a colleague coming in the back now. I'd like you to release over on her command in terms of head control. Okay,
yes,
so you two liaise, please.
Okay, I'm just about to take the patient's head. Okay. I have control of the
You
head.
have control and now releasing. Okay, Jim, you're in the hands of the paramedics.
Lovely.
now.
Hello, Jim. It's the ambulance service. We're just going to do some few checks. I want you to listen to me as we do some checks. I may be asking you
The
some
paramedic
questions
in
as we walk
charge,
through.
Richard, works through a patient assessment tool to decide whether the casualty has any emergency, life-threatening conditions.
The paramedic was talking to the patient to confirm that the patient was conscious and could talk, and then they would then assess the patient's airway further to make sure that they haven't got any sort of anything that could possibly cause a problem should they lose consciousness.
Thank you. Right, effort of breathing. The patient.
The glass is made safe using decorator's tape before it's removed from the vehicle.
Considering HEM's involvement as well with this patient. No catastrophic hemorrhage.
So the example of today, where the vehicle is driven into a wall, we would be looking for likely injuries that would be from that sort of pattern. So you would be looking for lower leg, upper leg, pelvic injuries, and abdominal injuries that you may well find with that injury, and obviously spinal and neck injuries as well that were indicated in
For
this.
me, run it around your mouth. Tongue out, thank you. Airway is clear. Fire brigade, instant fire, non-time critical.
Non-time critical.
Could well be some involvement with some further injuries with inside, but we've got certainly possibility of neck cervical injury here, possibility of some further multi-system trauma.
While the assessment continues, the fire crew makes the vehicle safe. This part of the operation is known as space creation, so that the paramedics can remove the casualty safely.
We want to ideally remove them in the plane in which they're sitting in at the moment. So the best way, if we've got the most amount of time, if they're sitting in the seat, is to take the roof off and take them out the back of the car in a normal line rather than twisting them and moving them around like that.
Is there a likelihood that it might go downhill slightly?
Yes.
Right, so my plan to you would be, first of all, to get this door open.
Right.
Okay, clear that.
Yep.
And then we're going to take that B post out so we've got full access there. Yeah?
Thank you.
After we've done that, we'll take the roof off.
Sure.
Okay.
Thank
Fellas,
you.
just listen in a minute.
And then we'll give them options for, we can take the side off, the roof off, the door off, etc. We'll agree a plan and then we'll look to execute that plan together.
Plan rapid X.
If the patient's condition should deteriorate, he'd need to be removed before they have time to take the roof off. In this scenario, removing the side door becomes plan B. If Jim's condition becomes time critical, he can be taken out of the vehicle and onto a stretcher within 2
In
minutes.
terms of non-catastrophic, airway clear, right? In terms of now coming down to breathing, flaps are clear, totally clear, no other further injury found. Yeah, coming on to circulation. Breaking glass.
Before taking off the rear door, they remove the plastic to look for seatbelt retainers or airbags that could create a danger.
That's fine,
Fire
thank you.
appliances all have mobile data terminals in them so that they can access technical data about any car on the road.
Think about coming in and getting the trolley out, around and back onto the back.
The paramedics start to get the kit ready so that they can take the patient from the vehicle. He'll be immobilised so that they can slide him onto an extrication board.
Just checking now, rear checking on AVPU, still alert on AVPU's patient is still talking to me. And again, a DCS as well from this patient, possibly a blood glucose reading at this point in time. No further need at the moment. Respiratory rate is coming back at about 24 rests a minute. So he's not actually triggering our trauma bypass tool. Has some guarding, boarding on the abdomen. We'll have a best look when we get this patient out. At the moment, still talking to me, still maintaining vital signs. Further check on your legs.
An airbag restraint mechanism covers the steering wheel so that, should it go off, it won't injure the patient further.
Stabilisation. Simon, just put the spreaders in underneath that
clear. Abdomen is still cause of concern.
That'll go quite easy.
So once again, just reiterate, going through now. In terms of patient's breathing, in terms of flaps pneumonic, in terms of feeling with this patient down the chest, it was bilateral, no crepitus, no emphysema.
Add that casualty.
Jody? Jody.
Yeah.
Are we ready with the KED, though? We're all right for KED? Lovely.
Are you happy for me to get the casualty shield right over the top now?
That's fine, you can come over. Jim, there's a blanket going over the top of your head there just to protect you from any flying glass, okay? Just going through...
At least one paramedic stays in the vehicle, keeping contact with the patient and updating the fire officers in case Plan B should need to be brought into action.
Attentive IV. If not, then we will use the interosseous access, either on the lower limb, on the tibial aspect, or the greater tubercle there, area of the patient's humerus with interosseous. So noise is coming over onto your left now, Jim. Got some cuts and bangs going on as we get on. Good. That's lovely. We'll stay with you throughout all this.
Okay, just listening. We've got full access down the side now. Should the casualty need to come out, all right?
Okay, thank you. That's great. Superb.
Yeah. Fellas, just listening a sec. We're going to go round now, taking the posts out. We're going to make sure that
when the B post has been removed, the crew cover any sharp areas which have been exposed by the cutting
make
equipment.
a little bit of noise and vibration on with the reciprocating saw, all right? So that'll be starting in a minute.
Final cut's going to come in, Jim. The roof's going to come off.
The whole operation is planned so that they move round the vehicle, and the final cut is the one next to the casualty, and they do that just before they take the roof
Make
off.
sure it's clear and then back. Okay, on you, Roscoe.
Check with the patient. Catastrophic hemorrhage is still clear. In terms of airway, patient has been talking, confirmed talking to me, asking me to cover his shoulders up. So in terms of his overall approach, in terms of Glasgow's coma scale, is good. In terms of further auscultation with this patient, going to feel down and then auscultate.
Fellas, let's get these sharps protection on all the car and check the stabilisation again. Check that.
Okay, fire. Okay, well, we're going to play this now. We want to come in, KED down the back.
Yeah.
KED secured. We've got enough room to work now.
Yeah.
Then we put extrication board in the back and then off.
Okay, so it's going on a KED and then a board?
Yes, please.
Okay.
So KED first of all, down, board, back, out.
Okay. Do you want that headrest off?
Please.
We can get that off.
Yes, please. Yeah. Right, Jim, I'm going to take control of your head. Bring your head forward for me. Lots of different people around you now. I've got control, Sophie. Yeah, you can let out. Well done. You can go. I've got control. Thank you. Right, Jim, I'm going to put a KED or an extrication device down your back. just to enable us to keep you nice and still as we extricate you from the actual vehicle now. So there's going to be some slight movement as we come in. Well done, Jim. Good lad.
The patient has to be prepared for the Kendrick extrication device. This will be used to slide him onto a spinal board. The fire officers also know how this works, and they work with the ambulance crew to apply it.
Stop.
The teardrop protectors that earlier had shielded the patient from the shards from the cutting operation are now used for slipping down between the patient and the seat so that the KED doesn't catch on his clothing. This has been discovered through regular experience of exercises like this held between the ambulance and fire crews.
Right, you've got control. Over to you. You have control. Can I have the, before we actually move, Jodie, can I have this collar reassigned, please? His chin has actually started to move. Thank you. We need to make sure you're okay with holding the head, Sophia. Yeah, okay. Then we can remove the collar and re-affix the collar.
We've got extra hands if you need them when you need them.
Thank you. Thanks.
Just taking your collar off, so I'm just going to realign it.
Good. Right, collar is reaffixed. Good. Thank you. Okay, let's now proceed then with application of the KED. Yeah. Just going to wrap this KED around you now. That's in. Done. And around. Good.
Yeah.
Ready with the board at the back there. Good. Going to bring that around on the head very shortly. There we go, John. That's in. That's in. That's in situ. Yeah, we're strapped. We're done. Okay. Head then. So we just need some coordination. So keep yourself there, Sophia.
Yep.
Well done. So you're going to bring this head device around by the side of your ears there. John, that's fine. No, we'll take over. I'll come in from the front of you here. Okay. All right, Jodie.
Yeah.
We're just going to come in and take control from the front, so you can get that in. Okay, Sophia, I have control.
Okay.
Right, that's it. Good. Well done. Release. Good. Well done.
I'm just going to feel a bit of padding going behind your head here. Right.
Just to take up the space there. Now the other's going to start to close around your ears. Forehead and chin strap going to come in just to keep you secure there.
Okay. Sorry, Jim.
Yeah, secure.
Jim, the mannequin, is a highly sophisticated dummy. He breathes, blinks, has a pulse and other vital signs. And the mannequin's medical condition can be controlled by an operator to challenge the emergency responders in a simulation exercise like this. The operator is also his voice, so Jim can talk to answer questions or give appropriate responses.
Hands on so we can hold them in situ when we lower that.
Yeah. They're just going to move you forward in your seat slightly.
Okay, yeah, I've got it. Yep, okay. I've released. There we go, John. That's lovely. Good. Well done. Right, that's now back in place. Good, that's fixed. Good.
So we're on your control on the head when you're ready.
Over to you then,
Okay,
Jodie.
so ready, steady, support.
Okay, and I'm going to recline the seat
Steady,
slightly.
recline.
That board can start going in. There's a nice space down to the spine gently. And that's brilliant.
Everybody brace.
Okay, now you can lower.
Happy to lower.
Just brace that hand here.
Whoa, hang on a minute.
Brace.
No, stop.
Okay.
Right, wait, right. We all ready?
Everyone brace.
There's kit that we tend to use quite often at this type of job, and again, as you'll note from the film, the fire crews are quite comfortable with it. They know what it is. They know which is the right way round. It speeds up the process, and ultimately it helps the patient.
So we'll all be on your command. Would you like us to lower the board when you're ready onto the back of the seats, which is by an angle like this?
Yep.
And then we can start shifting up the board on your command.
Right, so lower angle first of all.
Yes.
Yeah, and then onto a lower
So
angle.
we're
That's
on your
fine.
ready,
Okay,
brace,
yep,
lower.
down and then down. Right, Jim.
Happy,
Yep.
ready, brace, lower.
Good. Going backwards now, Jim. Good.
Okay, Jim. Just lowering you onto
Onto the back of the seats if we can.
Well done.
Relax, Jim. Nice, slow, steady breathing.
That's brilliant, and we're there.
Okay, just rest there a minute. Can I make a suggestion that we take the head from the other side now so we
Yeah,
can be
good
split up?
idea,
Yeah.
yeah.
Did you want to take the head or are you happy with one of
No,
us?
I'm happy with one of you guys.
Roscoe, do you want to take the head?
You've got nice gloves on. If you stand about here.
Do you have control of the head?
Okay, yep, and it's on my word, okay?
Okay.
Yeah, I'll have control.
You've got it behind the
I
legs.
can watch them as they come out. Yeah.
Okay, when everybody's ready then, just tell me you're ready. We're ready to
We're in
move.
Right, Jim,
position.
we're just going to slide you up the board, okay? Would you like me to do anything?
The fire service and ambulance crews use the same terminology to avoid misunderstandings. And because the two services regularly exercise together, the paramedics are happy to let fire officers deal with the
Okay,
spine
yeah.
support
Just
at
rest
the
there,
head.
Roscoe. We use the commands ready, brace, slide, yeah?
we ready to go again?
Yeah, hold.
Hold on a second. We just need to readjust the kedge straps.
This leg one here could just do a bit.
Yeah, you can just tighten the leg straps up.
So just so everyone can hear, the command will be ready, brace,
Brilliant.
slide.
Yeah.
Okay.
Good. Feet are free.
Are we clear to go all the way if everyone's happy
No,
with that?
halfway, Ross.
Halfway.
We'll go half again, please, and we can reposition. Thank you.
Ready, brace, slide.
Superb. We can release the leg straps now, can't we? Because he's going to go horizontal.
Not
He's
quite
free
yet,
there.
still at a bit of an angle.
Let's get him flat on the board.
Yeah, and then we can tilt.
Yeah, that's it.
Ready to go again?
Andy, just help with the control of the
Brace,
feet.
slide. Okay, dry.
Okay, and should we tilt?
Okay, Jim, you're on the board.
Okay, if we can go flat.
Go flat. Ross, you ready for us to get the boards flat?
Yeah, we'll have a ready, brace, lift. Okay.
Okay, on you.
Ready, brace, lift. So nice and level then.
Once the casualty is in the care of the ambulance, the fire service can make the scene safe. They usually debrief there and then. If it was a particularly serious accident, a multiple pile-up for instance, they would also have a formal debriefing session with all the agencies present at a meeting later in the year. Today's scenario was run by OxStar, which is based at Oxford's John Radcliffe Hospital and provides a variety of courses to maintain and update skills. As in this case, many of their courses use state-of-the-art wireless mannequins. These mimic real-life patients, exhibiting measurable vital signs which can be controlled by the trainer. Scenarios like these test medical skills, as well as leadership, decision-making and teamworking, all without putting anyone at risk.